Hello, and welcome to the ALCSI podcast, where we share stories of lung cancer patients and their caregivers, as well as the work of doctors and researchers in the field. Today, we have the great honor and privilege of having Dr. Eric Singhi with us today. Dr. Eric Singhi is a thoracic head and neck medical oncologist and assistant professor at the University of Texas MD Anderson Cancer Center. He received his medical degree from the Medical University of South Carolina College of Medicine and then completed his internship and residency training in internal medicine at Vanderbilt University. He subsequently completed his hematology and medical oncology fellowship training at the University of Texas MD Anderson Cancer Center, serving as Chief Education Fellow. He also speaks multiple languages, including Hindi and Spanish. He specializes in general internal medicine and hematology oncology. He has an interest in thoracic medical oncology, patient-reported outcomes, patient education, and community outreach. Dr. Singhi, we're so honored to have you in our podcast today, and thank you so much for your time.
Thanks for the kind introduction. Excited to be here with you both.
Of course. And to introduce our moderators today, my name is Pranav Mandiam.
And I'm Sam Schwartz, and we're with the American Lung Cancer Screening Initiative, a national 501c3 nonprofit working to raise awareness of lung cancer and lung cancer screening. So to get us started, Dr. Singhi, could you please just tell us a little bit about yourself?
Absolutely. Yeah, again, thank you for the introduction. It's always exciting, and I'm honored to be here to chat about ways to raise awareness about lung cancer screening, about lung cancer just in general for our patients who are going through so much. So thanks again. Like you said, my name is Eric Singhi. I'm a thoracic medical oncologist, meaning that I care for patients with lung cancer here in the Houston, Texas community, but also see many patients from all over the country and even outside of the United States. So really a privilege to be able to take care of their patients and sort of the loved ones that support them. I have a passion for patient education research, which I'm sure we'll talk a lot about during this podcast. And I also see a lot of patients that we deem as young onset lung cancer. So these are patients that are 50 and younger, which a lot of people don't know about. And unfortunately, it's a sort of underfunded and underrepresented subgroup of patients with lung cancer. So we'll talk about that too.
Awesome. That's so interesting. To start us off, how did you get into the field of thoracic oncology? Has that always been your vision since you were that you would end up in medicine, or did you envision yourself in a different specialty when you were younger?
Yeah, that's a really good question. So I like to say that cancer is a universal experience, but it's deeply personal, right? So we all have family members, we have friends, we have colleagues who have unfortunately been affected by cancer, and myself included. And so very early on, I saw that experience and I learned about not only the physical toll that cancer can have on the patient, but also the emotional toll that it can have on patients' loved ones, their caregivers, their friends, right? And that really stuck with me because I saw sort of those effects from the physical aspect all the way to the emotional aspect. And then we'll probably talk about this more too during the podcast here. But my maternal grandfather was a family medicine physician, and I was really close with him growing up. And so I got to see really the importance of that patient-physician relationship, what that meant, how it really breaks beyond the confines of just clinic and really extends to the home lives of patients and really impacts their families too. And so that meant a lot to me. And so then thinking about those two aspects, fast forwarding to undergrad, which I know you guys are either just completing or have just completed, and thinking about my pre-medical studies, getting excited about science, started to learn more about all these advancements and updates in cancer, particularly lung cancer. And that really got me excited about the potential of bringing these advancements to patients, right? And went on to do medicine residency, got some amazing mentors when I was at Vanderbilt, Dr. Leora Horn, Dr. Christine Lovely, to name a few, who are just pioneers in the field of lung cancer and really shaped my career, helped mentor and sponsor me. And I think that's so important, just mentorship, sponsorship, having someone to support your career and your interest. And that's how I sort of became who I am today, a thoracic medical oncologist.
That's amazing to hear about how enthusiastic and dedicated you are to this craft. And for those who may be interested in the future in medicine, who are listening, future in medicine, oncology, you don't it, things don't always happen exactly how you envision them. But at the end of the day, Dr. Singhi, you do amazing work, and it's truly an inspiration to us and everyone who's listening. So to move us a little bit to a different area. So you said you work at MD Anderson, one of the leading cancer centers in the nation and in Texas. Could you please talk to us about a little bit about what the screening rates look like in Texas?
Yeah, that's a good question. A loaded question, a little bit, and I think it's a call to action, if you will. So, the State of Lung Cancer report comes out every year by the American Lung Association, and so they just released that in November of 2024. And what I can tell you is, by state, they give all the details and statistics of how your state is doing with regards to lung health and lung cancer in general. And what I can tell you from that report is that for patients that are deemed high risk and eligible for screening for lung cancer, and I'm sure you guys have done a lot of excellent work about educating who's eligible, who's not. But for patients that are eligible in the state of Texas, only about 10.6% of patients are being screened, which puts us as state number 46 out of 50 with regards to lung cancer screening. So clearly we have a long way to go. That's really the bottom tier. But I think it's an opportunity, right? It's a call to action to raise awareness, educate patients, educate providers about lung cancer screening and really what the benefits can be.
Yeah, it's amazing. And I'm glad that you mentioned that it's a call to action because I know that Texas and Houston specifically has so many great medical institutions in the area, so many physicians like yourself, like focusing on lung cancer and lung cancer screening. And I know that we will be able to improve the screening rate in the future as well. And I guess moving on a little bit, I know that you spoke earlier about young onset lung cancer. So I know that some of our viewers might not be familiar with what young lung cancer is. Do you mind talking about a little bit more about what it is, what the risk factors are, what the prevalence is for this?
Yeah, absolutely. So traditionally, when I was going through medical school training, even early during my fellowship training, we talked about what the average age of diagnosis was for lung cancer, and it's about 65 to 70. So usually when you think about lung cancer, there's a lot of stigma, there's a lot of misconceptions now. I'll tell you what the traditional sort of definition has been. So older adults, patients with a heavy smoking history or still currently smoking, right? But a lot has changed. There's this phrase that I use called, or what you may have heard, the face of lung cancer has changed. And so now we're seeing patients who are younger, patients with no smoking history. They don't have those traditional risk factors. And that includes patients who have young onset lung cancer. Our community typically defines these patients as 50 and younger, right? So that's a big difference from that average age of diagnosis of 65 to 70. The statistic that I can quote you for the United States right now is that on average, with regards to the patients that are currently being diagnosed with lung cancer, it's about 20% of patients who have no smoking history, don't have that traditional risk factor, yet they're being diagnosed with lung cancer. And many of those patients, unfortunately, are under the age of 50. So hence, I think it's a growing phenomenon. It's one that needs more awareness. It's one that needs more dedicated funding. And it's a subgroup of patients with lung cancer that I'm very passionate about.
Kind of building off that, like you just mentioned, you said there's a trend of individuals who don't meet the traditional risk factors of lung cancer. For our listeners who are not aware, currently the guidelines for lung cancer screening to be covered by insurance, Medicare, Medicaid, is you have to have a 20-pack year smoking history, which means you smoke a pack a day for 20 years, half pack for 40 years. You have to be between the ages of 50 and 80, and you have to be within 15 years of quitting. So that's the current eligibility for lung cancer screening to be covered. But like you just said, a lot of individuals don't not only don't meet that criteria, many individuals don't even have a smoking history. Um, Building off of that, what do you think we could do in the future to change potentially the criteria for eligibility for lung cancer screening?
Yeah, I think that's a great question too. They actually looked at the feasibility of it being able to do this. So looking at lung cancer screening in patients that don't have a traditional risk factor. And right now that the country that's done it is Taiwan. So there was the Taiwan study that I think they went over the results at a previous World Lung Conference, actually. And they showed that let's think outside of the box here, not just that traditional anchored risk factor of having a personal smoking history, but what about patients, for example, that have a family history of lung cancer, right? Can these patients get screening? Can we see a benefit from lung cancer screening? And they showed it. So I think really learning from that study that there is a feasible way to do this. It needs to be data driven, of course, I think as well. But really we need concrete initiatives to really study it, to show its feasibility, to show the data behind it and support it. I'm a big believer in it. I know there's a lot of people that are doing exciting work as well, looking at specific subgroups of patients who may be at risk for lung cancer. So I think in time we will have answers. It's definitely something though that needs focused, concrete initiatives.
Yeah, it's great to hear about that. I know that for a certain part of your like in your journey as well, you've been making informational videos online as well, alongside your work as a clinician and a researcher, as a role of as an influencer. And I was wondering if you can speak about how you got into making those videos, why you're making those videos, and some of the concepts that you've been talking about in some of your videos.
Yeah, well, I'm honored that you're calling me an influencer. I don't know if I consider myself an influencer. I like to consider myself an educator. And I think you can educate in novel ways and not only educate yourself, not only educate your colleagues, but educate patients. That's really important to me. And that's the research that really drives me and gets me up in the morning to really do what I do. And so I got into social media. Not really on purpose, to be honest. So I was doing my training as a hematology oncology fellow during peak pandemic COVID. And you guys probably remember it was a highly isolating experience. We needed to quickly learn about what was going on, how to help patients, how to protect not only your own health, but the health of others in your community, right? And so I was trying to find ways to connect and communicate with, different scientific members that really had expertise in COVID, had expertise in cancer care. And I got onto X, or it was Twitter back then, and started connecting with the lung cancer community and realizing that there was a lot of education going on, particularly for providers, particularly for trainees, particularly for colleagues, right? There's a lot of academic chatter to help yourself learn and help colleagues learn. But what I saw was this void. There was this void in not having dedicated patient education on social media, right? So prominent providers with expertise with cancer care, particularly lung cancer care, not as many of them were particularly creating educational resources, educational information, and videos, things like that, directed towards patients to help them understand, to feel empowered about their care. And so, sort of fast forward until just a little over a year ago, I got onto more patient facing platforms like TikTok and Instagram and started making patient friendly content, right? So, how can we take some of the most promising findings in research with regards to lung cancer and show patients that, hey, there is hope, hey, there are developments, and making it easy to understand for them? And started experimenting with fun ways to do it, right? So not only these fireside chats where I'm sitting down and really official and trying to break down the studies, but I also will do walks by a local park, Herman Park here, for example, and just chat about random thoughts and ask questions of patients and things like that to share information. Even more creative, and started doing some dances like on TikTok trends and trying to just tap into engage and educate at the same time. And it's been really rewarding.
That's absolutely amazing how you have been able to use new platforms to educate individuals about lung cancer screening, health in general. One of the interesting things that when we go out into the community as ALCSI chapters at college campuses is a lot of the times the people that we're interacting with aren't the ones who are actually eligible for lung cancer screening. Like, we go to a health fair on campus, and the students there do in no way meet the eligibility for lung cancer screening. However, one of the important things that we want to tell individuals is that when we educate you about lung cancer screening, you then can become the advocates for your family members and your friends. And I think that's such an important thing that you're doing is when someone watches a video, when a kid like myself who's 19 years old watches one of your videos, they themselves are not eligible. But now that they're watching it, maybe they send it to their father or their mother or a family member. And in that way, they become advocates for the loved ones in their lives. And I think that's truly amazing that you do that.
Yeah, yeah, thanks, Sam. I really appreciate that. I think there's this opportunity to build a network, right? Social media is a lot about connecting and making us feel less isolated, but it's also an opportunity to tap into a network to educate and empower. And so you highlighted that perfectly, and I love that aspect of social media.
It truly is amazing. So you've made these videos, these informational videos that have collectively accumulated thousands of likes. A little shout out. We were wondering what has been your favorite video you've made, or a video that you feel has had the largest impact on the community.
Okay, yeah, that's a good question. I told you there's a lot of different formats that I've experimented with. The dance ones take some time to learn the trends, but I actually used to do Bollywood dance and Bhangra dance back when I was in college and in high school. So it's fun to tap into sort of that creative side because it's been a while. So those ones may be the most challenging. I think the ones that I think about, forget the likes, forget the shares, all of that, is when you can make an impact directly at the bedside with what you're producing or what you're making. So I'll give you an example. I did a video series about asking your physicians about second opinions, how do you navigate that, and talking about clinical trials just in general for patients. And I actually had a medical oncology provider, not in the state of Texas, a community oncologist who let me know that their patient actually brought my video to their clinic visit one day and said, "Hey, there's this doctor talking about clinical trials. Like, what is this? Do you think I'm eligible for something like this?" And this was the first time that they were able to have an honest and engaging conversation about, yeah, I didn't know you were interested in clinical trials. Let's talk about it. These are options. And that physician actually told me, hey, because of your video and me seeing it in clinic with them, sorry, I'm getting emotional about it because every time I talk about it, it's just so impactful. But they literally said, because of your video and them showing it to me, I was able to open a dialogue about clinical trials and what that could mean for the patient. And that patient is now on a clinical trial. So that's just an example of forget the likes, forget the shares, but the direct impact that you can still have as a clinician using social media to help patients directly at the bedside. So that's probably my most meaningful one.
That's actually so amazing. And it's so good that you're able to make this impact with patients through your videos, not only your own patients, but also patients across the US and the world as well. And I was wondering, like, what do you think it can be done in the healthcare field similar to your videos and all that, which can help improve patient education overall in the lung cancer field?
Yeah. I mean, forget social media or maybe even in conjunction with social media, we need to have dedicated, concrete research efforts that are focused on patient education, right? And so that's something I'm very passionate about. And so, forget just asking patients on surveys, hey, what do you prefer? How can we help sort of empower you during your cancer care journey, which I'm very involved in. I've done a lot of different studies like that. We also need to prospectively study this. So how can we integrate patient education resources into clinic? How can we make sure that it's feasible for a really busy clinic, right? A lot of oncologists are very busy. And so every minute counts. And you want to make that impactful connection with your patients and empower them and educate them and go over their treatment plan. It's a lot. It builds up. So you want to make sure that whatever resources you're developing, whatever efforts you're developing and sort of dedicating to patient education, that they can be feasibly integrated into clinic. And so that's something I'm actively involved with right now too, thinking about how we can prospectively study the benefits of patient education resources and really show that direct benefit for patients and show it for providers.
Amazing to hear about your interest in patient education. I was just curious, what has some of the research you have done into patient education in the
Yeah,
past?
yeah, absolutely. So I told you a little bit about the prospective study that we're trying to develop and hopefully launch. We did something as well that was presented at World Lung back in Singapore about 2 years ago now. And we actually assessed the availability and demand for patient-friendly resources in lung cancer. So we worked with different patient advocacy groups to really figure out, hey, what's currently available with regards to patient education that's dedicated to patients with lung cancer? And then what's the demand for developing new resources? And we saw that there really isn't a lot of patient-friendly resources that are dedicated to patients with lung cancer, helping them understand their diagnosis, helping them understand their treatment plan. Why was a particular treatment plan selected over another one? Like, what's the data behind it? And we learned that patients really do want it. And they not only want it, they want it discussed and developed directly by their provider team. So, not third party companies, nothing like that, but they want their own doctors, their own teams using it, developing it. And that's a really meaningful finding, right? That it's a call to action that we got to have the physicians in the community, the physician assistants, the pharmacists, the actual people that are providing care to patients with lung cancer involved in developing these resources. So that's just one example of sort of some research that we did in the past and the findings that we got.
That's amazing. And switching gears a little bit, I know that a lot of patients are looking, a lot of patients also would like to have second opinions on certain things and certain procedures or consultations that they have with physicians. And in your opinion, what are some times when a patient should seek this second opinion and how should they go about seeking a second opinion?
Yeah, that's a really good question. And I actually made a video about this, and I think it was really helpful to a lot of patients, and I got some comments about it too. I think a lot of times patients get really nervous about talking about a second opinion. So the first thing I tell people is it's okay. Make it an open conversation with your current physician and their care team. Get them involved. Tell them, hey, I'm thinking about a second opinion. Let them know why you're thinking about a second opinion. Is it because you're interested in clinical trials? Is it because you simply want to know, are there other options? Is it because you want reassurance, right? Patients need to feel empowered to be able to have that conversation, and they need to know it's okay to be able to do it. So that's the first thing I think is just awareness and normalizing that second opinions happen and it's okay. The other thing I'll say is a lot of times I can still work with their primary team back at home. So I don't always see patients from the state of Texas. I also see patients outside of the state of Texas or even outside of just the Houston area in general. So some patients will come for a second opinion. We'll talk about a plan. We'll talk about potential clinical trials, and then they'll go back home. So I think there's different ways to do it. Each case is different. But patients should feel empowered to have that conversation with their primary team at any point in their cancer care journey. I'm a big believer in that.
I think that's awesome. And I think there's probably a lot of patients may have had bad experiences in the past, or they may have um, the notion that a lot of physicians don't enjoy or like when their patients go to other people, but or to other physicians. But I think almost every physician that we've talked to, thoracic surgeon, oncologist, has been very supportive of their patients seeking second opinions, because at the end of the day, physicians want to see their patients be happy and live the lives that they want. So if that involves seeking another opinion to getting the best treatment or options that's available to them, that's what, like you said, like that's you are a doctor who wants the best for their patient, and so are so many other physicians. So expanding a little bit on that, do you have any other tips for how a patient could advocate for themselves throughout the entire treatment process?
Yeah. So one of the things that I really like doing in my job is working with patient advocacy groups. Your group, for example, but there's also some amazing groups that are out there for patients with lung cancer just in general, even based all the way down to their particular biomarker of lung cancer. So I think really engaging with patient advocacy groups can go a really long way. It's really impressive and important to be able to connect with people who are exactly in the same shoes as them, right? And not only that, but patients need support, but so do their caregivers and their loved ones. And so it can build that network like we talked about. Patient advocacy groups really provide that sort of way to navigate the system, the support that not only patients need, but their loved ones need. And so I'll really work hard to connect patients with patient advocacy groups. I think that's so important. The other thing I would say to do is it's okay to ask questions, right? Write down your questions. Sometimes questions come at 2 a.m., 3 a.m., and that's not the best time to ask your team, right? And to reach out or to call, but write it down, and then bring it up at your visit. That's the best thing you can do is really writing down anything you're thinking about, engaging in conversations, and making sure that you have that open dialogue with your team. So those are some just basic tips that I tell all my patients.
That's awesome. That's some great tips. And yeah, and honestly, we're also grateful to have you in this lung cancer advocacy community and doing so much for the community here in Houston and Texas in general. I guess for the last question, how can our listeners get in contact with you? What are some of your social media handles that they can watch some of your videos on?
Yeah, thanks for asking. But before we get into that, I just want to say I really appreciate all the efforts that you guys have as well and what you've done for the Houston community, what you've done for the US in general. I remember the first time I came to talk to the Rice chapter was about a year and a half ago now, and I was blown away by just how engaged and excited you young people are about helping get the word out there about lung cancer just in general, about lung cancer screening. Um, I cannot tell you just how teary-eyed I got about it, how proud I felt. I finally feel like this older person, even though I'm a young oncologist. I was just really proud of all the efforts that you're doing. So thank you for doing that. Really appreciate you both and the entire organization. In terms of reaching me, my social media handle, which I changed about a year and a half ago, and it's been stable, and you can find me on all platforms, is at lungoncdoc. So made it easy, and yeah, I appreciate the follow and I appreciate the shares and becoming an advocate about lung health and lung cancer in general.
Well, first, I want to say Pranav and I and the rest of the ALCSI organization really appreciate all the work that you do, and we really appreciate your time and your kind words to our organization. And while you said that you were inspired by us, we are truly inspired, and we look up to you and other individuals like you. So thank you for all the work that you have done and will continue to do. So, like I said, it's truly been an honor and a pleasure to talk with you, Dr. Singhi, and learn from the experiences, the knowledge that you have gained in the field of lung cancer screening. And we appreciate all the work you are doing and your perspective as a thoracic oncologist and a passionate advocator and educator. And we want to thank our listeners for joining us on this ALCSI podcast. We hope you enjoyed it. We certainly did. And please keep an eye out for all upcoming podcasts and events, which will be posted on our website at www.alc.org. Thank you, everyone, and have a great day.